our niche is health service provision and health advocacy. It's all the services that our beneficiaries or right holders get from this space is purely free of charge.
Wow.
Yes, we give our services free of charge. So it's just being bold and believing in your initiative and what you want, you know. And as long as your cause is pure, we are here, we are women, we have special needs. No one has been programming around health.
Good morning. My name is Felicity Mudis. Welcome to this week's episode of the Business Corner. We are so honored to be here at Lawi with the CEO and founder of the organization. So I'm going to give her a chance to introduce herself, and then we will get this conversation on the road. Hi.
Hi, Felicity.
Thank you so much for having us.
You're welcome, Felicity.
Please tell us your name and tell us a little bit about Lawi.
Okay. So my name is Kasera Ogola. I'm a queer woman. I live in and working in Kisumu. Obviously, you're in our space. So I work for Lake Region Women's and Radical Rights, CBO, community-based organization. We started, or we basically conceived the idea of coming up with this initiative, to bridge the gaps of, health service provision specifically for LBQ agency persons in Western Kenya. We officially registered in 2021. Of course, we started those processes way back in 2020. And then, of course, we opened our doors early, actually, I think mid-December of 2021. And we started having clients in January 2022. So it's been an amazing journey. And the fact that we are partnering with the Ministry of Health, Kisumu County, is very big for us. More so the fact that we are domiciled within a public health facility that is in Mombasa County Hospital is very big for us, because then we are sure that we are able to sustain our programs, our health programs, that is, for the LBQ GNC persons.
Now, wait, Ministry of Health, first of all, can we just park there for a second? How did you do it? And you are right in the middle of a public health facility, like a government facility. How did that happen?
I think it's just being bold and believing in your initiative and what you want, and as long as your cause is pure, having those conversations with the with the people perceived to be in positions of power, becomes, or people perceive that they're very difficult. But when you're bold and you take the right steps and talk to the right people, it's easy. So I think it was very easy for us, because sometimes back, I think from 2019, 2020, as we're in the process of registering and starting up, I was fully engaged in key populations programming. I was working as a program associate for Trans Alliance here in Kisumu. And during my work there, we were doing a lot of health programming for trans community in Western Kenya. And we kind of formed a very close working relationships with the Ministry of Health officials that are, working around key populations programming, and that includes NASCOP. So by the time I was getting off of Trans Alliance, to back this baby, already I had those, those networks, those networks. So what I did, I walked into the Ministry of Health, introduced myself as a queer woman, having this big idea to do health programming for LBQ women. That has never happened before. The LBQ movement in Kenya specifically is very vibrant. But the GPMSM are programming around health, but the health programs that they have specifically respond to the needs of either trans women or the GPMSM, or men who have sex with men. But the specific health needs or sexual reproductive health needs for queer women, had been ignored for a very long time, and nobody was programming around health specifically. So I had this conversation with the Ministry of Health, of course, specific persons responsible for those dockets. It took time, but we are here.
Oh my God.
Here we
that
are.
is amazing. That is so brave and bold. I'm like, I'm Kasera, I'm trying to imagine how the conversation went down. And I know you have touched a little bit on it, but what was the major inspiration behind Lawi?
The major inspiration, I think, came from me personally and my experiences as a queer woman. I mentioned that I used to work. I'm a trained healthcare worker, and
Yes.
I worked with the Ministry of Health Kisumu County for I think slightly over 10 years. I was seconded to the Ministry of Health by ICAP. ICAP specifically implements around HIV care and treatment in Kisumu. So they seconded me, and I was stationed at JOTRH. So in JOTRH, I was offering clinical nutrition services for people living with HIV, and I would see queer women coming to seek services, but apart from just getting their ARVs and going home, the other important sexual reproductive health services they were not getting. So by the time my contract came to an end with ICAP in 2019, and just got myself into mainstream gender activism in Kisumu, I promised myself that that's a gap I would want to, I would want to fill.
Yes.
Yeah, so that was the inspiration behind it. And of course, when I entered, or when I started active gender activism, of course I met queer women who were like me, who were professionals, healthcare workers, and we had a conversation. I mean, why don't we come together and do something for our own community? So initially we just needed a space within a government health hospital or an institution that had systems where we could volunteer even once a week to give health services, or specifically SRH services to our community.
Wow.
And then by the time we're getting registered, and by the time we're getting this space, it was no longer possible to just give services once a day. So that's why I'm doing Lawi full-time. I'm fully working for this organization full-time, because it was never just going to be enough to give once a week. Yeah, so it's something I'm very, very, very passionate about.
That is beautiful. That is beautiful. Now that we are on that path of speaking about it, what are some of the challenges that you have faced so far?
So the main challenges is resource mobilization, or getting someone who believes in your cause, who can give you the full support. In terms of, so when we're talking about support, it goes beyond capacity. We need money to implement some of the programs that we are implementing. And of course, we've also learned that funding for LBQ in this country as a whole, not just Kisumu, is not in the same level like the GBMSM movement.
Yes.
So right now, apart from just implementing programs within this space and doing the health advocacy that we do, we're also trying to be in spaces of LBQ movement and pushing the LBQ agenda, so that we are on the same playing field with the other GBMSM movement that has been there for a very long time. We are trying to make noise to people who have these resources, that we are here, we are women, we have special needs, no one has been programming around health, and I think we also deserve to be given something small to continue doing the work that we do. So yes, one of the major challenges is resources to do the kind of work that we do. And then of course the other challenge that we're still struggling with is stigma and discrimination. Of course, is still there. I can 100% say, or 99.9% saying that we've made Lumumba sub-county hospital a very safe haven for the queer community in Kisumu, because we are here, we sensitize the healthcare workers, that work within this space, and because we are talking integration, we've managed to also be part of the hospitals CME, continuous medical education, and we engage them. Like, we don't even have to have money to engage them every day, to engage them once in a while. We engage them every day. So long as we are scheduled to give those talks, we are always there to give those talks. But it's unfortunate that is just what happens within Lumumba. But we're still having challenges, within the other spaces that are offering health services that are public, that people are supposed to access without stigma and without discrimination. But unfortunately, that still happens. But we are saying we're still young. We are not able to, sensitize everybody, and we're really hoping that, with the growth and with the kind of growth we've seen since we opened our doors, we are really hoping that 5 years from now, 3 years from now, we'll not be talking about these issues anymore. And then of course, another major challenge is that we find it very difficult to programs specifically around HIV and AIDS, because LBQ women, are not classified as vulnerable to HIV. So I have never understood who sat down and said that if you're a woman and you're having sex with a woman, you're not susceptible to contracting HIV. So that's it's very absurd. It's something that it's a challenge that we're still working on. We are engaging the right people. Like, we recently became a member of the Kisumu County Gender Technical Sector Working Group. We became a member of Key Populations Technical Center Working Group. And it's in those spaces that we make noise and we say we are here. There's data, because we collect data here. We do services. So in a month I can actually say that this percentage of queer women got infected with HIV. Not that because they are bisexual, but probably it's because they had sex with someone who was born with HIV. Those are conversations we are not having. So, yeah, those are the main challenges we're dealing right now. Yeah. So,
what are some of the services that you offer?
So, our main niche is specifically sexual reproductive health. So we offer family planning services, so family planning option services for queer women, because we are also partnering with private fertility clinics. We are giving essential commodities like condoms, dental dams, lubricants, but there are some commodities, of course, that we're still having a challenge accessing, especially finger condoms. And then, of course, we also do cervical cancer screening, breast cancer screening, and even trans women come into this space to get prostate cancer screening, and then, of course, general medicine for our community, and of course something also we're doing and we're very passionate about is a response to SGBV. And it's been amazing, because intimate partner violence is something that we've struggled with for a very long time in our community, but the fact that we are here and it's also serving as the second gender-based unit in Kisumu after JOTRH, queer people are more open to reporting cases of violations, especially in regards to intimate partner violence, and they are willing, to go all through the way to get legal redress, because we're giving them that support to be able to do that. So we are seeing a shift. Vis-a-vis before, when you had a case of IPV or SGBV, and you respond, you refer client to either the police station or JOTRH. Then along the way they're like they're frustrated, they don't want to go, they don't want to continue with the process, and the vicious cycle of intimate partner violence continues. So I think basically that is those are the few services that we offer in this space. And then, of course, I would not finish answering that question without mentioning that we are also very big on abortion services, but we don't do the actual services here. So we are partnering with other private and public institutions that have those mandates to refer our clients to get those services there. So that includes abortion services and post-abortion care services. I mentioned that we also have an in-house HTS counselor who does couple counseling for queer women, and we are able to offer HTS services every day throughout the week, from Monday to Saturday. Yeah.
Wow, that is impressive. You are doing a lot.
It's a lot.
That is a lot. How do you manage to balance all that?
I think managing or balancing all that is very, very easy, because we work here full time. So it's very, very easy, and I think balancing that also has been very easy because of the kind of integration we've done. We are the first. Actually, in Kenya, we are the first organization that that opened up a space specifically to give health services or SRH services for LBQ women.
Wow.
Yes.
Wow.
We're the first in
That's
Kenya.
Big. Yeah, congratulations.
Thank you so much. We are the first. So because of that big responsibility that we have, integration is at the core of everything we do in this space. So we've integrated our services to within the health systems, or within the government health systems, that is within Lumumba Sub-County Hospital. So that means because of the teachings we've done, the sensitization we've done, when a client walks in and our clinical officer is not in, they're able to be seen by any other clinical officer as long as they work within this government hospital. So I think that has also contributed a lot in, enabling us to balance so that, we maintain the quality of services that we give to our clients. Yeah.
Impressive. How many employees do we have? I'm just been curious to ask that.
We are currently 6, so it is me. We have a finance person working for us full-time also. We have an office admin, and then of course we have a community liaisons officer. We have an HTS counselor, and we have a clinical officer who is seeing clients for us, and of course the hospital are also giving us trained counselors to be in this space full time. So in total we are 6, but support staff are 2. Yeah.
Wow, that is big, that is amazing. So of course, to one of the other very important questions, how do you manage to be able to make money even out of this? I know it's a community initiative, you're trying to help people, but at the end of the day, you are here full time. So how do you manage to also be able to make something for you?
For me?
Yes. And for your employees?
That's an interesting question.
Yes.
Because we are a community-based organization,
Yes.
basically we are a human rights organization. We don't make money, we don't have initiatives, to make us profit. All the services that our beneficiaries or right holders get from this space is purely free of charge.
Wow.
Yes, we give our services free of charge.
Wow.
All my support staff, the people who are here full time to help me, are all volunteers.
Wow.
Yes, all of us are volunteers. So I mentioned that I work full time. The accountant is here full time. The other staff, we've made their terms of reference to be very flexible, because then if you're not paying someone, you don't expect them to be in the office the whole day, because we're also just trying to be in line with the government human resources policy and employment act. Yeah, so they're not full time because we're not paying them. So they volunteer 3 hours in a day. 4 times a week. Yes, but we're resource mobilizing so that we can get a fund, so that we have all these people working for us full time, because even the clinical officer comes in 4 days a week. But the other times I've told you that we've integrated our services, and the government healthcare workers are able to see our clients because they are trained on that.
All right. So, any word of advice that you'd give to someone who would like to do something like this?
My only advice is you have to be true to your cause, because then if you're not true to your cause and you don't believe in your cause and you don't believe in giving back, then losing focus becomes very, very easy. And then of course staying consistent, and then of course you cannot be a jack of all trades. You have to identify that one thing that you're passionate about, and stick to it. Like for us, our niche is health service provision and health advocacy. So all the other things that surrounds health, like safety and security, because you cannot talk about SRHR and you don't talk about SGBV, and you don't talk about gender, and you don't talk about human rights and all that. But our main niche is health service provision for our community. And of course health advocacy, so that we continue pushing the LBQ health agenda in advocacy spaces.
Amazing, amazing. This has been so beautiful. I have actually learned quite a lot. So in case someone wants to be able to access where you are, is there somewhere on social media or a phone number or just your exact location where they can reach you?
So our official numbers is still 0700 079 061. That is our official numbers. You can find us on Instagram at Lawi 21. We are on Twitter at Lake Region, and then of course Facebook at Lake Region Women's Health and Equal Rights. We are very active on all social media, pages, and then of course we have a very active website. You can dial or Google lawi.org. Then you'll be able to find all the amazing work that we do. We document there.
Amazing.
Yeah. But physically, we are stationed within Lumumba Sub-County Hospital. That is in Kisumu Central. You cannot miss Lumumba Sub-County Hospital. And we are only the queer organization in a public health facility, so everybody obviously knows where we are. So if you come in at the gate and you want to ask where Lawi is, of course don't use Lawi because most people do not still know how to pronounce the abbreviation, but just say that you're going to the GBV unit. Then you'll be able to find us to get services.
Amazing.
Yeah.
Amazing. That is beautiful. So your final word, anything else you want to say? This is your moment.
My final word is that as a queer woman living and working in Kisumu, there are still challenges that the queer community goes through. We cannot give up because love is love, and health rights are human rights, and everybody deserves to receive healthcare services despite what they identify as. Yeah. Everybody deserves to be treated equally.
That's true.
Yes. Yeah.
Awesome. I did not realize you were done. Literally. Thank you so much for having us. Thank you for talking to us. This has been beautiful.
Thank you.
We appreciate you for creating time for us. And I would also like to say a huge thank you to you who has been watching this. I hope that you have learned a thing or two, and sure that you reach out to them in case you are in need of any of the services that they offer over here. Have yourself a beautiful day. We'll see you again soon, sometime next week. Bye.